If you're a healthcare professional treating vein conditions, you probably believe one of these myths. I know because at various stages in my career as a vein specialist, I believed all of them. In this video, I'm going to cover the 5 common myths that most vein specialists believe, and at the end, I will tell you what I think is the only solution to total vein care. So let's get started, and be sure to check out all the links in the description. Myth number 1. Endothermal ablation is better than foam sclerotherapy. Now, this is not true, despite what the guidelines say. In terms of what patients consider important, there's absolutely no difference. Nearly all the guidelines have a hierarchy of treatment options, and most, including the influential NICE guidelines, put endothermal ablation at the top of the list. Foam sclerotherapy is relegated to second place. But I've argued that these guidelines are fundamentally flawed, and indeed, the most recent and comprehensive review of endothermal ablation, looking at all the literature versus ultrasound-guided foam sclerotherapy, confirms this, and it questions whether the hierarchy is actually a reasonable proposition. Myth number 2. Recurrence rates are super important. Now, many experts believe that recurrence rates really matter and go to extraordinary lengths to achieve super low recurrence rates. Truth is, there's no significant difference in recurrence rates over a long period of time, no matter what treatment option is chosen. All patients will develop new vein problems or recurrences after a sufficiently long period. To put it bluntly, there's no cure for venous disease. Like dental disease, lifetime care is necessary. Myth number 3. Foam sclerotherapy causes DVT. Most vein specialists who are not familiar with foam sclerotherapy seem to be really concerned about foam entering the deep veins and causing DVT. This fear is totally unfounded. We now know from extensive original research by Parsi and his colleagues that when foam sclerotherapy is performed by experts with certain special precautions, the DVT rate is super low, 0.07%, a staggeringly low figure. Check out the reference below for more details. Myth number 4. Foam sclerotherapy causes stroke. Here's another myth that many vein experts, including very prominent luminaries in the vein world, they propagate this myth that foam goes round the body, enters the brain and can cause stroke. Well, a huge study, a prospective study of over 8,000 patients, which observed neurological adverse events after ultrasound-guided foam sclerotherapy with fibrovein, showed that the overall incidence of serious adverse events in that study was 0.57%, with serious neurological events specifically occurring at a rate of 0.049%. That's low. People aren't being caused strokes by foam sclerotherapy when you consider how many foam sclerotherapy treatments are performed around the world. Stroke is vanishingly rare. If people were suffering strokes after foam sclerotherapy, there would be an outrage. It doesn't happen if it's done properly. Myth number 5. Patients want everything done in one go. Okay, well, I admit, I used to believe this too. I would spend a lot of time in the treatment room treating both legs with laser, injecting tributaries with foam sclerotherapy, and extracting veins by phlebectomy, meticulous phlebectomy, spending a long time doing it. I had some great before and after photos just to show the results and how quickly they were achieved. Turns out this is not what most patients want necessarily. They want to be cared for. Follow-up and making patients feel safe after their treatment is far more important. This is what patients value. In all my time treating patients with vein disease, I've never had a patient come to me prioritizing the need for treatment in one session over the other major considerations such as the eventual outcome, affordability, safety, discomfort during the procedure, just to mention a few of the important factors. Whatever treatment is provided, you as a healthcare specialist, a vein specialist, you're going to have to provide ongoing care for the lifetime of your patient. So at the beginning I said I would tell you what I think is the only solution to total vein care. Well, you've probably guessed it now. If you've listened to any of my podcasts before or read anything I've written, you know I'm an advocate for foam sclerotherapy. The solution to total vein care is a combination of ultrasound-guided foam sclerotherapy and ongoing care for your patients who are inevitably going to have recurrence, who are inevitably going to have a recurrence of symptoms, who are inevitably going to have ongoing reflux. Now, don't get me wrong. I'm not saying ultrasound-guided foam sclerotherapy is the best treatment. As Alessandro Frullini in one of my recent podcasts commented, it's like saying that a Ferrari is the best car in the world. It depends on what the priorities are of your patient, what they want. Now, if you currently provide endovenous thermal ablation by laser or radiofrequency, if you currently perform phlebectomy and ultrasound-guided foam sclerotherapy, great. I don't have an argument with you. I'm not saying you're doing anything wrong. What I'm saying is that to provide complete vein care over time, over the lifetime of your patient who are inevitably going to get problems in the future, you need to become an expert at ultrasound-guided foam sclerotherapy. And, more importantly, ultrasound-guided foam sclerotherapy is at least as safe and effective for saphenous vein reflux and tributaries as anything else. Don't listen to what the guidelines say. Look at the evidence yourself. Don't listen to luminary experts who talk about glue and stripping and glue versus laser and glue versus stripping. Look at the evidence yourself. You're going to have to get good at ultrasound-guided foam sclerotherapy. Now, in this respect, I'm in complete agreement with my colleague Chris Pittman. If you have watched any of my podcasts, if you've read anything that I've posted on LinkedIn, you'll know that Chris Pittman is an expert in foam sclerotherapy. He's got a foam sclerotherapy expert group on LinkedIn, and I urge you to join it to find out more about how foam sclerotherapy can be incorporated into your practice. Now, if you enjoyed this video, please consider giving it a thumbs up and please share it with your colleagues. It really does help get the word out about foam sclerotherapy. And if you'd like to know more about foam sclerotherapy and how it integrates with endothermal ablation, phlebectomy and total vein care, consider coming to the British Association of Sclerotherapists annual conference in 2025. The link's below. Thank you for watching. Maybe you disagree. Maybe you think I'm wrong. Let's start a conversation. Leave a comment below. I promise I read all of these and I'll try and get back to you as soon as I can.